Just a second. All right. Good morning, everybody, and welcome back to Security Health Plan Academy, our monthly webinar series created to provide you with information relevant to your health, wellness, and healthcare plan. Today, we are very fortunate to have returning guest speaker, Dr. Katie Stearns, with us to present on the topic of home safety. During today's webinar, Dr. Stearns will identify safety risks throughout the home, and she'll offer tips and tricks to modifying your home environment to reduce the likelihood of falls and injury. She will also provide information on the role of inpatient, outpatient, and home health physical therapy services as they relate to fall risk assessments, home modifications, and simple equipment to increase your safety. So Katie, you can go ahead and dive in.
Perfect. Thank you very much. I am very happy to be back. The last one I did was on osteoarthritis in March, and I'm thrilled to be back. So thank you very much. Real quick introduction. I'm Katie Stearns. I'm a physical therapist. I've been at Marshfield for almost 12 years now, and I work in the outpatient setting in the comprehensive pain program and spine. So thank you again for having me. All right, so our goal as physical therapists is always almost exactly the same as your goal, is to keep you in your home for as long as possible. And the way we do that is to make sure you're safe and everything is safe with your home. So just a quick overview. We're going to first talk just a few statistics. I know stats are never anyone's favorite fun topic, but a few statistics, and then some risk factors, tips and tricks to minimize those risk factors, and then our role as physical therapists in the home safety world. And then finally, some resources at the end online that can be very helpful for you. So, all right. So all of these statistics are for older adults. They label it older adults, even though 65 is still very young, but all of these stats are for adults 65 years and older. So my first one is falling just once doubles your chance of falling again, which doesn't seem to be too big of a deal. I know I have a lot of patients when I ask them if they've fallen, they say, yeah, but it was just once. And, the cat ran out in front of me, or there was just water on the floor. It doesn't matter. If you've fallen once, it doubles your chance of falling again. So it's very much a slippery slope that you just need to be conscious of and be careful of. 1 in 5 falls result in a serious injury, such as a broken bone or head trauma. More than 800,000 hospitalizations every year are due to falls. The two main serious injuries we see are traumatic brain injuries and then hip fractures. A traumatic brain injury, you think it sounds and is a kind of a big deal. Like, it has to be significant trauma. You have to lose loss of consciousness, and it really doesn't take scary. It's kind of scary, but it really doesn't take too much to get that brain bleed, especially if you're on a blood thinner. Even just taking ibuprofen daily it will thin your blood, and you just honestly, just a little bump can do it. So be very careful with that. And then hip fractures, we see a lot of them. And honestly, I've been in the clinic for 14 years, and I'm not sure I can say I've seen a hip fracture that has not been due to a fall. Maybe one motor vehicle accident, but they're all very, very common for falls. And once you fracture a hip, you become immobile, and all of your health kind of goes downhill from there. So we really try to prevent those hip fractures and those falls. Falls are the leading cause of injury death. This is from 2019. I tried to find it more current, and I couldn't. But 34,000 is quite a few. So that mostly we can, most of these, not all, but most of them we can prevent. So, all right, some risk factors. Weakness is a big one, whether it's general weakness, more like full body, just fatigue, or specific weakness, meaning your left leg is weak, because you had a knee replacement or you're recovering from a stroke or whatever. So general or specific weakness is a really big one. Poor diet. If you have a vitamin or mineral deficiency, that can definitely create more of that full body weakness, that fatigue, that can increase your chance of falls. Orthopedic pains and injuries. Who doesn't have, some back aches, or, if you just had a knee done, ankle pain, all that kind of changes the way you walk, which increases the risk of falls as well. Medications are a big one. Every medication you take has a whole laundry list of side effects. And a ton of them include drowsiness or dizziness. A lot of sedatives and antidepressants are included in that, but that can be a big one too. Vision, poor vision or change in vision. So even if it's an increase or a decrease, getting better, getting worse. Normally it's more getting worse, but it can go the other way. It can happen pretty quick, and that can increase your risk of falls, or just you have poor vision and you don't know where your glasses are, or you're just going to go to the bathroom real quick. You're going to be right back, so you don't wear them, that sort of thing. Vertigo is that sensation, you're dizzy, that sensation that the whole room is spinning. It has to do with it's an inner ear issue with the crystals in your ear, and that can definitely make you more prone to falls as well. And then another risk factor that's very easy to improve upon would be footwear, whether it's slippery shoes or slippery socks or shoes that are kind of falling apart. You need to get some new ones, shoes that are too small or too big. That sort of thing. So going on, we have some more risk factors here. Home hazards, and this one is one that we really kind of, as physical therapists, really kind of focus on. Rugs in your house, whether they're slippery rugs or just the kind of change in surface, which leads me to the next one, change in surface, even from hardwood floor to a little bit of a carpet, just that little less, a half an inch change can catch your toe or your shoe and cause a trip and fall. Stairs are a big one. The shower tub, spilled water or water from the shower, by far the most falls happen in the bathroom. So that is the bathroom we really kind of focus on to try and help modify. Pets, they're cute. We love them. I don't know what I'd do without mine, but they definitely are a risk factor for tripping. If they run out in front of you, you don't want to step on them, and one thing leads to the next, and that will definitely not be good. Low tables or ottomans. This one gets missed a lot. I'm surprised, but anything that's not at eye level, that's lower. So if you have an ottoman or a hassock or something like that, you can turn, not see it, and it can take your legs right out from under you. Clutter, which can be anything and all over the house. Even grandkids' toys, we hear a lot about that too. The grandkids are over and they have their Hot Wheels or their, this and that all laying out. Poor lighting. That kind of goes without saying, I suppose. Cords, extension cords, phone cords, electronic cords. And I feel like this is definitely getting more and more common because everything needs to be charged. Everything is all the electronics we have. It can create for kind of a spaghetti mess of cords. Poor organization. And I guess I don't even want to know if I should say poor, just different organization. A lot of times we see this in the kitchen. Bowls or mixing bowls or stuff you don't use a whole lot are either way up high or way down low. And I do it too. It's just kind of the stuff you use the most, you put right in front of you. But that can definitely, even if you're not standing on a step stool to get something, even if you're on those tippy toes and your arms are up, anytime your arms are above your head, you're going to throw off your balance and increase risk of falls. So this next one I actually added just late because my godmother and aunt just fell and broke her humerus of her arm because she was making her bed and the blankets were at the foot of the bed on the floor, and she came around the corner. Her feet got tangled up in the blankets from the bed and she fell right on the shoulder. And that's another tough one, is you're never going to really have your range of motion back after that. So I kind of added that one last minute. So so that was kind of like the doom and gloom. It give you the stats and then the risk factors, and it would be terrible with me if I just left it there. So here are some tips and tricks to kind of improve upon the safety of your home. So the first thing is, I always say, make it practical, not fairy tale. And this came from prior to me having children. My house was beautiful. It looked like a magazine. I mean, everything was, it was just worked out perfectly. After you have kids, anybody knows, you take care of all that stuff. You get rid of the, all the decor and all this, and you make it as safe as possible too. And the same idea goes later on in life, is you want to, the floor plants, for example, they're beautiful, they love it, but it's one more thing that you can possibly trip over. So get rid of all the beautiful decor and fairy tale stuff, and just keep it as practical and as safe as it's possible, because honestly, it's just not worth it. It's not worth the risking the fall. Rugs, take the rugs away. I know you can get things that kind of keep the rug sticky to the floor, but we really try to just get rid of them. Bright tape at the top of the stairs. There's a picture there that is actually glow in the dark tape. You can get neon bright tape, you can get glow in the dark tape. It's kind of fun and actually is very helpful. Not only at the top of at the stairs, but any change of surface. So where the hard floor meets the carpet, put a strip of that tape. It catches your eye pretty well, and it will reduce the risk of falls. Handrails. This is another one. We have a lot of people that say, a lot of patients that say they have a handrail on one side, which is great. One is better than none, but we really try to encourage, if possible, handrails on both sides. Grab bars are really nice, especially in the bathroom where all those falls happen from the getting out of the shower and the toilet. Any steps, if you can't put a full railing, you can try and do a grab bar. If it's just like 2 steps to get up, you can do that too. Back to the bathroom, textured no slip strips in the bathtub. That water will do it for almost anybody, so really be careful of that. Same thing in the bathroom, raised toilet seats. That really has to do with more of the weakness too. If you're too weak, whether it's because of total hip replacement or just fatigue, the getting down and getting back up, we see a lot of falls from that. Increase the wattage of your light bulbs, brighten it all up in there, open the curtains, keep it nice and bright so you can see all the obstacles. And then night lights all over the place. Some people really like the motion censored, because as soon as you get up, they'll go on for you, but light up those, all the rooms in the house, especially on your way to the bathroom. From the bedroom to the bathroom is huge for night lights. And then reorganize that kitchen. Do your very, very best to get everything within reach, so you don't have to stoop low or reach high. I know it's easier than it's harder than it sounds, but definitely important. So some more tips and tricks. Outdoor spaces. Everybody forgets about the outside. We have a neighbor, well, he actually passed, but he was 90, almost 100 years old, and he did not fall one single time in his house. But I can't tell you how many times my husband and I went over there, because he took his walker on the front yard to go look at his bird feeder. And he would, oh my goodness, I don't know how many times we went over there to pick him up. So really, really focus on the outside as well. Any sort of landscaping, decor, rocks, holes like those moles. I was saying before, my husband cannot stand those moles. I think he loses sleep over those holes in our yard. Cracks in the driveway, all that sort of stuff. So go around the inside of the house, but don't forget walking around the outside of the house as well. One of the greatest things you can do for yourself is regular visits to your primary care provider. More than half of the people who fall, even if it's just once, more than half don't even say anything, because they just got some scratches, or that it was just this, or it was just one time, all the kind of the excuses there. Tell your provider though. They are your gateway for referrals. So if you need to be referred to one place, or vision or whatever, they can take care of that. Medication checks. This one is super important too. If your dosage changes, make sure you talk about that. Or one that I see quite a few is people are put on blood pressure medications to lower their blood pressure. They do great with it, but then they change their diet because they want to get healthier too. So they change their diet, and now the dosage of their blood pressure medication is too high though. So now it's really bringing down, between the medication and the lifestyle changes, it's bringing their blood pressure down too low, and you can get dizzy and lightheaded and fall from that. Vision, keep your vision checks. Blood pressure, we kind of talked about that too with the medication checks. And then blood work, deficiencies in vitamin D, all your vitamins and minerals. They can keep an eye on that for you. And then diet, eat healthy foods, regular meals and snacks. So a lot of people skip breakfast, but it messes with your blood sugar. Low blood sugar, you can pass out, you can get dizzy. So regular and healthy meals and snacks are very, very important for everything, not just home safety, but clothing. Bathrobes, we see a lot in wintertime. We live in Wisconsin. In wintertime, everybody has the super soft, fluffy, long bathrobes. But we see that get caught on like a railing, or they'll get caught on things, and then it can increase some tripping. So not that you need a, above knee one, but even if you just take a foot off the bottom or so, that will help. Non-slip socks. Everybody thinks of the hospital when you get these, and there's so much more to the non-slip socks. And I mean, if you just do a quick Amazon or Google search, you can get some summer ones, you can get some winter ones. They don't have to look like they came straight from the hospital. So very, very helpful. This over here, Tom Cruise, this is good for Hollywood. This is no good for normal us people around the house. He's got a rug there, he's got a plant decor, he's slipping all over the place. So it worked well for Tom in Hollywood, but that is not what we're going for here. And then same thing, appropriately fit shoes, so they're not too small, too tight. The ties versus Velcros, Velcro shoes versus slip-on. The ties are going to be the ones that we try to get rid of, because you can obviously trip on them. So all right, going on. Yes, there we go. An exercise program. So this will lead me into physical therapy, but you don't need physical therapy to do an exercise program. You can do a very basic, very simple, very effective exercise program on your own, or at your gym with a personal trainer or something like that. But stretching, strengthening, balance work, pool therapy or aquatic stuff, and then yoga. Yoga is one of my go-tos, one of my favorite ones, because it incorporates everything. It incorporates flexibility and strength, balance, and all of that. So again, that's going to lead me into physical therapy, our role. And I have a slide later on in this, but the experts of home safety is definitely our home health PTs. The inpatient physical therapist does a great job of making kind of assessing before you leave the hospital, before you go home. Us an outpatient, we do a lot of balance training, strengthening, and exercise. There's a lot of balance assessments that we can do. There's, I don't even know how many, a ton of them. These are just a few of them: the tug, Tonetti, functional reach, tandem stance, 5-minute walk, 30-second chair stand. So they're all balanced. They're all going to assess your fall risk in different ways. The biggest thing with this is, yes, they're useful. Yes, they'll give us an idea of your fall risk, low, moderate, high. However, they're not perfect. So just because they say you're a low fall risk doesn't mean you're not going to fall. Just because it says you're a high risk doesn't mean you are going to fall. And the research is pretty clear on relying on one single assessment will under-recognize fall. So it's going to kind of give us a false sense of security when it comes to sending you home in fall risk. If we do 2 or 3 of them, it's definitely going to increase the accurate effectiveness of these. But unfortunately, in the clinic, we typically, to be honest, we typically don't do multiple because of the time constraints mostly, which is not okay. But in other words, they're nice. It's a nice assessment. It gives us a good idea, but we can't hang our hat on that because there's so much more to it than just these quick assessments. And then in physical therapy, we can do some stretches. In my humble opinion, I think stretching is one of the most underutilized thing we can do. And it's basic, it's simple, everybody can do it at home, and it is very helpful. Our muscles have that elastic property, so that's what defines them as a muscle. They can contract and relax. When we're young, babies and toddlers and kids, it's crazy. They can fall and just kind of bend, but not break. As we get older, we lose some of that elastic property. So we're more likely to, if we fall, we're more likely to break and not bend. So we really want to focus on stretching. Strengthening is also one of the things that we really focus on. We're going to focus on more of an endurance strengthening versus more endurance than strength. So we're going to do low repetitions. I'm sorry, high repetitions of low weight. So I really don't care if you can lift 200 pounds one time. I want you to do lightweight over and over and over again. And that's what gets you, through the day which kind of leads into endurance too. I mean, you can walk to go get the mail, no problem. But if you're walking the mall at Christmas time for, you're not doing anything strenuous, but you do it over and over and over again, your body starts to fatigue. And that's when we see a lot of the falls as well. Balance, the difference between static balance and dynamic balance, both are important, but I would argue that dynamic is the way to go. Static meaning you're pretty much, how long can you stand on one foot, or put your feet together, and how long can you stand still, which is obviously very important as well. But the dynamic balance is more realistic for everyday life. Like you're in the kitchen and you turn to get into the refrigerator and you kind of lose your balance that way. So it's more of a balance while moving. Just mimics more of your life activities. So we really focus a lot on that too. Aquatic therapy is a fantastic option. If you do it through physical therapy, a lot of times what we'll do is we will put you in the pool with a physical therapist trained in the aquatic exercises. And they, depending on what you are being seen for, they will give you an exercise program and go through it with you to make sure you're doing it correctly. And then you'll be on your own. So you can go to Gold's Gym or the YMCA and kind of do the exercises on your own. Really great option because the water has the buoyancy property. So it really kind of holds you up and limits the falls. You can even put a little flotation device around your waist, and you can work on walking forwards, walking backwards, that dynamic balance as well. Really good option. I think that's underused as well. And then vertigo, I added this one just because it is typically such an easy fix for a very debilitating disorder. People are absolutely miserable when they have a true vertigo. And if we have some therapists that are specialized in it, but it's usually just some quick maneuvers and then some basic, exercises that you do at home, and it can fix it very quickly, very nicely. And people always say, why did I wait so long? I should have done this a long time ago. So that's that. This was kind of going back to the home health physical therapists. They're the physical therapists that come to your house and do exercises with you there and do your physical therapy with you at your house. They are by far the experts in home safety because they are in your house. They can see everything and what could be a risk factor and how they could improve upon that. Your primary care provider would be the one that would give you a referral for home health physical therapy. The good news and the bad news. The bad news is they have very strict criteria for this to be covered, such as you have to be completely homebound. You really can't leave your house for anything. The good news is no matter your insurance, no matter whether, they will end up covering it in the long run, they will always do one visit. to come to your home to assess. Really what they're doing is they're assessing if you qualify for home health services. And if you do, they will set you up with that. If you do not qualify, they're already in your home. They will still look around, take a walk around, and give you some tips and tricks on what you can do to make your home safer. Whether it's get rid of this or change this up, or adaptive equipment too, like this would be a great area for a grab bar or a shower chair or anything like that. So people don't utilize this as much as they should either. So, but most people also don't know that they will do that one visit. So, all right. Finally, we have some resources for you to look on at home independently. These are all four of these are really, really great. I don't know if we can, I know we're going to send this out too. So I don't know if this will work for, let's try the ADRC. The ADRC is the Aging Disability Resource Center. A lot of people surprisingly don't know about this, but it is a fantastic resource for individuals that need help, or if you're the caregiver of an individual who needs some help. One of the things I use this most for would be the loan closet. And every county has one. So like I use the Eau Claire County, but they have a loan closet. You can borrow shower chairs and wheelchairs and walkers and that sort, canes and all that sort of stuff. So you don't have to purchase them. They also have more fun stuff like your magnifying glasses and your large print playing cards, all that sort of stuff. So lots and lots of resources here. So go online, find, this is the link. You can kind of put where you live in and it'll bring up your counties. Let's see how I'm going to get back here. All right. I really, like I said, all of them are good. This top one is a check your risk for falling. So it's an assessment tool, but it's for the home use. So you don't need any special tools to do it or anything like that. It's just kind of a yes and no question. Add up your responses and they all have a number value. And if it adds up to greater than 4, you have an increased risk of fall. So again, don't hang your hat on it. Don't get too worked up about it if you score over a 4, but it is kind of a nice tool to use. This bottom one is the Security Health one, and I was really impressed with this one. They did an awesome job with this as well for fall prevention, risk factors and causes, all that sort of stuff. So you can kind of go through these independently on your own to see, kind of just to see what they all have to offer. But that's those are some of the resources that I like the best. And then finally, I want to end with this one. You can do anything, but you cannot do everything. So please, please, please do not hesitate to reach out for help. I don't know why, but people seem to really hesitate, especially the older population. They hesitate to ask for help. Even some will fall and they'll lay there. They don't want to bother anybody. They'll kind of lay there until someone comes to check on them. Or they don't want to bother with anybody, you know, to get a cane, or it doesn't matter. Reach out for help. Tell your primary care provider. They can give you so many good resources. If you do physical therapy, honestly, you can email me and I will try to help you as much as you can. I will direct you to where you need to go. But so many falls could be prevented if you just ask for help. So please, please do not hesitate to ask anybody in your family, in your neighborhood, in your medical community for some help. So, and that's about all I have. So if there are any questions, that would be great.
That was great, Dr. Stearns. Thank you so much.
Absolutely.
If anyone from the audience has a question, you're welcome to unmute yourself and go ahead and ask. We'll take about maybe a couple minutes to open the floor. If there are no questions, Dr. Stearns, I'm wondering, what is maybe a common question you hear in the office setting from patients?
You know, I would say one of the things that patients will bring up to me the most is, how do I know when I should be using a cane? Or how do I know when a cane's not enough and I should be using a walker? And and I don't blame them, but a lot of people are hesitant to, I don't want to say give up their independence, but that's how they feel it is to start using that cane, or switch from the cane to the walker. And you know what? I don't think there's not a cookie cutter answer to that. Everybody is very different. There's some people I see, using a cane. I'm like, oh, we don't need that. We can get you, we can do it without. And then there's a lot of people that it's like, we need to get you, for your own safety, we need to get you some sort of assistive device. And I think that's more common than the former. But, if you have even a kind of a, I don't want to say fear of falling, but if you worry about that, the research shows that will increase your risk of falls too. So if you start to even kind of think, I don't know if I'm ready for it yet. If you're even kind of going that direction, it's something to kind of try out. And I usually tell people there is kind of we do gait training with a cane and gait training with a walker. So not that it's hard by any means, but there is kind of some tricks and tips with getting upstairs and curves and all that. So don't wait until it's too late. It's better to get trained in it now, get one that fits you, will fit it for you, exactly your height and everything. Get it early. And that way, if something change in health or whatever, if something does change, you have it, you're ready for it. Versus, so kind of be proactive about it instead of retroactive so that would be my biggest thing. And again, I'm all for, let's not use it if we don't have to, let's use our muscles. But when it comes time, it's time. But yeah, there's no right or wrong with that. It's more of a personal preference, and your health and your medical needs change pretty quickly. So it's a kind of a cop-out answer on my part, but it truly is more of a case by case decision, I guess.
Great. Any questions from the audience? Oh, here's one that just came in. This person says, my father is 102, which, oh my goodness, good genes in your family.
Great.
That is wonderful. He refuses to use his walker, and when we take him out, he will only use a cane. He refuses to turn lights on and has only one night light. I'm wondering if there's any guidance, maybe Katie, you could provide to.
That's a hard one, because when they get to 102, and I don't blame them, when they get to that old, they're going to be pretty stubborn. And they're going to kind of do it their way. One of the biggest things I've seen with that is they, most of the time, will listen to a medical professional prior to listening to family. So if for example, if I was going to see this one and you could talk to me beforehand, and I could really do my part to kind of really try to get them to see the importance of it. I don't know. I have some people that just go and install a bunch of night lights, and that's just what they do. They're motion activated. They install them all over. I don't know. I see the benefit of that, but also then I see how that could go. That could kind of backfire on you as well. But yeah, I don't know. By the time they're that age, a lot of times no one's going to tell them, one way or the other. But I will say, coming from different medical professionals usually works better than coming from, as a physical therapist. Oh my gosh, I try and give my mom and dad exercises. And they'll listen to a physical therapist they go to the clinic to see, but for some reason I'm family, so I'm still having a hard time getting them to do it. So it's hard coming from family.
I think that's true for a lot of things in life.
Probably.
It's hard to take advice from people close to you sometimes.
Probably, yes.
Yeah, I think then I'm not seeing any other questions come through the chat feature, and I do see some friends starting to trickle off. So I think we can go ahead and bring this call to a close. for this webinar. But if anybody that joined us today has any questions, you are welcome to submit those, and we will get those over to Dr. Stearns for her expert opinion. So yeah, thank you so much for joining us again. We're so appreciative to have you on our series, and I hope that we can get you on another time.
Perfect.
So,
Thank you so
thank
much for
you.
having me.
Yes, be well, everyone. Take care.
Bye.